Mr. Buckley, you may begin.
Thank you, Your Honor. Would you please state your name and occupation for the members of the jury, if you will?
My name is Dr. Wilbert Roadheaver, Chair of Psychiatry at Mississippi State University and Clinical Director of the Whitfield Facility for the Criminally Insane.
Thank you, Doctor. Your credentials speak for themselves. Now, Doctor, can you please explain, as you do so eloquently in your book, the McNaughton rule for the jury?
Certainly. The McNaughton rule states that a person must be unable to tell right from wrong and or be unaware of the consequences of his actions to be termed legally insane.
Now, did you examine Mr. Haley?
Yes, Mr. Haley and I spoke about his childhood, his family, his experiences during the war.
And the rape of his daughter?
Yes, we spoke at length about the brutal rape of his daughter, Tanya.
What is your diagnosis of Mr. Haley's mental condition on the day that he shot Billy Ray Cobb and James Lewis Willard?
At the time of the murders, his mental condition was without defects of any nature. Mr. Haley was sane.
Oh, but wait a minute, Doctor. The defense contends why Mr. Brigance has gone to a great effort to prove to this jury that Mr. Haley is a nutball, is a slow coach, or what's the clinical definition? Insane. Do you disagree?
Yes. Carly Haley knew very well what he was doing. He slaughtered those men in cold blood.
Thank you, Doctor. I have no further questions, Your Honor.
Buddy, where the hell is Roark?
I got no clue. Cross-examination, Mr. Begans.
Your Honor, we would request a recess until... No, we will not need a recess, Your Honor, but just a few moments.
Mr. Begans, when you and Lois Lane are ready.
Just a few questions, Your Honor. Doctor, who do you work for?
State of Mississippi.
In your 11 years working for the state, how many times have you testified in trials where the insanity defense was used?
This is my 46th trial.
46 trials. Well, of those 46 trials, how many times have you testified that the defendant was legally insane?
Objection, Your Honor. The good doctor cannot be asked to recall all of his testimony at these previous trials. It's absurd.
Overruled.
Thank you, Your Honor.
I can't remember.
Could it be, Doctor, that the reason you can't remember is that in 11 years and 46 trials, you never have seen a defendant whom you have found insane?
I can't recall at this time.
Can you recall testifying at the trial of one Dan Baker?
Objection, Your Honor. This has nothing to do with the proceedings here.
Overruled. This better be good, Mr. Begans.
Thank you, Your Honor. I'll ask again. Can you recall testifying at the trial of one Dan Baker? It's a rather brutal double homicide where you found the defendant legally sane?
Yes?
A dissenting psychiatrist disagreed with you, Doctor. And Mr. Baker was found insane and institutionalized. Where is he currently, Doctor?
At Whitfield.
And who is the chief psychiatrist at Whitfield?
I am.
You are. Dr. Roadheaver is the chief psychiatrist at Whitfield. Now, help me make this clear to the jury, Doctor. In 1985, you testified that Dan Baker was legally sane. The jury disagreed with you, and Mr. Baker was found not guilty by reason of insanity. Since that time, he has been a patient in your hospital under your care as a paranoid schizophrenic. Is that correct, Doctor?
Yes.
Do you normally admit patients, keep and treat them for 10 years if they are of sound mind and body?
Of course not.
Then it would be fair to say that you find insane people sane for the purposes of trial.
Objection, Your Honor. This is argumentative.
Withdraw the question, Your Honor. No further questions.